Now I'd like to turn to Dr. Valerie Tarasuk, who's going to be speaking to us about household food insecurity. So before you come on, I just have a little question for our participants here, which you'll see on your screen as a poll. The question is, what do we think? Was household food insecurity improving before COVID-19 or not? And this is a yes or no question. All right, so an overwhelming 90% say no, it was not. Thank you all very much for that. So I would like to invite you to speak to us about household food insecurity and what we're seeing there. So what is driving the growing household food insecurity in Canada, and how has COVID-19 impacted food insecurity for communities across the country? And also, as you respond, you'll talk to us a bit about what we're seeing as some of those critical community and policy responses which we need to put in place to actually end food insecurity. Welcome. Thanks for joining us, Al.
Thank you, Samantha. Thanks others for signing on. It's wonderful to see the results of that poll. I could see from the list of names here that we have a very well-informed audience. so I'm not surprised with that 90%, but it's great to see. So first of all, a clarification about food insecurity. We're seeing a lot of reports about rising food insecurity, both nationally and internationally. And I just want to hone in on one little thing. I'm triggered in part this morning by me reading an article about rising food insecurity in the Globe and Mail. Absolutely, as we move forward with this pandemic, our food supply is being disrupted on many fronts, right? And you all know that because as eaters, as consumers, you're having experiences of that disruption all the time. It's important to differentiate that food systems effect of COVID-19 from the more nitty-gritty problem of food insecurity in Canada. In high-income countries, food insecurity is very much about people's ability to access the market system, because that's how most of us, almost all of us in higher-income countries garner access to food. So we define it as inadequate or insecure access to food due to financial constraints, because that's where this thing hits us. So yes, there are food supply disruptions happening, and that will continue to happen, that are raising a lot of questions about our food system itself. But my comments about food insecurity refer specifically to those who are unable to access the system, irrespective of what it looks like, because they don't have enough money in the purse. Before COVID-19, we had released a report saying that about 4.4 million Canadians were living in households that experienced some level of food insecurity, and that included 1.2 million children under the age of 18. Everything we know about what's happening now would suggest that the situations of that 4.4 million people are now getting worse, and that more people will be joining their ranks. Who's most vulnerable? Well, I think there are two groups that are very vulnerable that are worth talking about this afternoon. The first are people on social assistance. They, before COVID-19, only comprised about 15% of the food insecure in Canada, but they were a very worrisome group because their incomes are very low, and so they are the group that are most likely to be experiencing severe food insecurity, so actually going without food because of a lack of money. As prices rise and there are more and more disruptions to people's ability to access basic needs, I think we can expect to see more people becoming severely food insecure. And so it's very concerning to think about people on social assistance right now. The dollars that they're getting in their benefits cannot be going as far as they did even before COVID-19. Who else is concerned are people who, at least prior to COVID-19, were employed but food insecure or at risk of food insecurity because they were working in low-wage jobs, maybe precarious work, short-term part-time work, and unable to make ends meet despite being in the workforce. About 2/3 of the food insecure in Canada before this pandemic were in the workforce. So food insecurity and this problem of low-waged, inadequate, insecure work has always intersected in our country. Now, with the job losses that we're seeing, we've got more people that are struggling with less money. Yes, there have been interventions happening federally in the form of, most recently, the CERB, the Canada Emergency Response Benefit, and also the Wage Subsidy Initiative. What we don't know is how these things are impacting the intersection between work and food insecurity in Canada. What I think we do know is that neither one of those benefits has really been designed to take care of this issue. So if they do, it's going to be a little bit of a side effect more than an intention. So for those of us working in this field, I can tell you we're very worried about people falling through the cracks or the CERB benefit. $2,000 sounds like a lot of money. If you're trying to feed very many people with that amount of money and pay the rent, it actually isn't very much money at all. So it's worrisome how that response is moving forward. The fact that we're seeing these new income-based responses in the context of the pandemic is a really good thing. And I'm sure many of you who are on this webinar know, many of us have started to talk again about basic income or an income floor as a way to move forward, as a way to deal with the fact that there are cracks in the current system as it's being hastily constructed. So I think that's a conversation that will be an important one to take going forward. Lastly, I just want to comment on the other kind of response that is rolling out feverishly through this pandemic, and that is the growing talk and money being put on the table for food banks and other sorts of charitable food distribution systems. I don't know how familiar any of you are with the literature in this area, with the research in this area, but before the pandemic, what we knew about the intersection of food insecurity and food charity was very problematic. About 1/4 of the people who were food insecure in this country were ever even receiving food from a food bank. So 1 in 4. In some parts of the country, that ratio was even lower. So most people who were food insecure were not receiving assistance from food banks or food charities before COVID-19. And we had no evidence that those who were getting help were able to manage. So what we knew is that the people who were most likely to use food charity were those who were extremely food insecure, severely food insecure. So people really, really struggling to have enough to eat. But what we could also see from the studies that we and others have done is that food charity wasn't enough to fix those problems. So they were using a food bank was a strategy of desperation, but it wasn't one that resolved the problem, because the amount of food people got was not very much, and their problems went way beyond food, right? Somebody who's struggling to afford enough to eat is also somebody who's struggling to pay their rent, to pay for prescription medications, to pay for all kinds of other things. So you give them a bag of groceries, and you haven't really made a dent in that bigger cascade of financial needs that are what define that household. As we go forward now, we're seeing this, all kinds of grand gestures celebrated wildly in our popular press. So we had the Prime Minister a few weeks ago announcing $100 million for community-based food charities. We've seen private sectors stepping forward. We've seen all kinds of celebration of that activity. In part, I think motivated by very positive things, right? People struggling to try to figure out what they can do to help others in their community, recognizing the need. But what is important in a webinar like this one to take away is that that's not enough. And that's where we have to go back to taking a look at the more structural responses, the income-based responses. We don't have anything in any evidence that anybody in Canada has collected so far to suggest that these patchwork charity programs, even with the infusion of cash from the federal or provincial governments, will be enough to fix this problem. So it's very important not to delude ourselves that that's the way forward now. Yes, it's what's happening, but it's important for us to go back upstream and say, we've also seen the rolling out of a whole lot of income support initiatives, or a couple of them anyway, a couple of very big ones, most importantly CERB. Let's talk about how we can make those kinds of initiatives better able to insulate Canadians from food insecurity. Okay, I'll stop there for now, but I'm looking forward to the discussion of this topic going forward. Thanks.
But thank you for that, Val. I think you're making a really compelling argument for us to move from food charity models to models which actually address the income problem. As you're speaking, I was thinking about work. One of my questions is, if we're going to have a basic income conversation or an income floor, what is that amount? Because I would agree with you on $2,000. Doesn't sound like a lot. For the longest time I lived in Toronto, and I think about what the average rent for a one-bedroom apartment in that city is, and $2,000 really barely barely gets you there. The Wellesley Institute did some work in Toronto looking at what's up, using a measure called the minimum income for healthy living. And the argument there is this is actually the income which lets people thrive and not just survive. So as we get into the discussion, I wonder if that is something which we can think about more and just think, what is that base amount and what kinds of conversations do we need to be having as we think about expanding things like SERB and other programs that should be put in place. Thank you.